With a breast augmentation, as with any surgery, there are risks associated with it. And while these risks may be small, it's important that as a patient you go in understanding what those risks are. So there are some risks that will occur immediately or shortly after surgery. And those risks include things like a seroma or a hematoma or an infection. So a seroma is a fluid collection around the implant. A hematoma is when there's blood around your implant. And an infection is also a risk where you may notice a red, warm, hot breast. These types of complications will most likely require another trip to the operating room to resolve them. However, the risk is extremely low, less than 1%. So it's 0.00, something like that. So it's just something you need to understand. Then we also have complications that can occur down the road. Most commonly, those things would be like your scar is not as pretty, which we can easily fix, or things like capsular contracture, which is the scar tissue that can form around an implant. And when that scar tissue forms around an implant, it can become hard and painful. And that would also require a removal and replacement at some point. And another risk that can happen down the road is your implant can rupture. These implants aren't going to last forever, so it's important to understand at some point you will have to replace them.